Healthcare IT Leaders, and I'm your moderator for today's webinar. I want to welcome you to today's event, a discussion of the top 10 trends in healthcare QA and testing for 2015. Before we get started, let me make a few housekeeping announcements. First of all, today's event is being recorded. The webcast replay and these slides will be made available to you within about a day of event conclusion. Look for an email to follow from us right after today's event. There will be 2 poll questions during our event. You can participate by answering in the poll window on your screen using your cursor and a mouse click. Your microphones are muted right now, so we can't hear you, but you can submit questions during the webinar using the QA box at any time. You should see this to the right hand of your screen with your GoToWebinar widget, and Mike will answer questions as time permits at the end of our webinar. For direct follow-up with our speaker today, you can email Mike at mike.cooper@healthcareitleaders.com. Mike is also on Twitter with the handle QA Cooper. Before we get started, let me tell you a little about our company. We're one of the nation's largest and fastest growing healthcare IT consulting and staff augmentation firms. Our clients include large integrated delivery networks, major hospitals, payers, life science, and pharma companies. Our QA and testing solutions include consulting and staffing, and we also manage 2 U.S. onshore testing facilities, complete with state-of-the-art test tools, providing specialized QA and testing services for the healthcare industry. And you can learn more about our company and our services at healthcareitleaders.com. Here are your speakers for today. I've introduced myself. I'm Alex Gramling, the Chief Marketing Officer at Healthcare IT Leaders. And our primary speaker is Mike Cooper, our Chief Quality Officer. Mike is an acknowledged thought leader in QAT. He was previously the QA and testing evangelist for HP Software. He's also led large QAT teams and initiatives at companies like T-Mobile USA, FICO, and Equifax. Mike is a certified Scrum Master. He's spoken at numerous industry events for testers, including Star West, HP Discover, and SAP's Sapphire Conference. And he's a contributor to the latest World Quality Report issued just recently by HP, Capgemini, and Sogeti. Mike, good afternoon and welcome.
Alex, thanks for the kind introduction. I truly appreciate the opportunity to share a topic I'm very passionate about, empowering QA and testing teams to deliver more value, especially in healthcare. Next slide. Alex, we're living in exciting times. Technology is transforming every aspect of the way we live. Perhaps no area is more important or more profound than the innovations we're seeing in healthcare technology, from mobility and telehealth to big data analytics and predictive analytics, predicting pandemics and preventing diseases. As life sciences and healthcare industries face real business challenges, we look to leverage technology to increase access to information, drive better patient outcomes, and meet government regulatory mandates. With that in mind, we've compiled some important information from industry research, analyst reports, and real-world experience about the top trends in healthcare quality in 2015. For each trend, we'll share some guidance to help impacted QA and software testing teams to be successful. Before we get into the trends, let's hear from you. What are your most significant QA and testing challenges? Alex, please launch the first poll question.
All right, Mike, we'll get that poll launched here, and everyone should see this on screen. And again, we ask you, whoops. Well, we've had our first poll snafu here. Let me launch the poll, and there we go. So what is your organization's biggest QA and testing challenge? You should see the poll on screen, and we'll ask everybody just to use their cursor and mouse and tell us what you're seeing in your own organization. We'll give everybody about 30 seconds here to cast a vote. Again, you should be seeing the poll question on your screen. What is your organization's biggest QA and testing challenge? And you have several options to choose from, and I see many of you are voting, so I appreciate that. We'll give the poll just a couple of more seconds here to let everybody cast their vote.
I'm curious to see which one it is. All of these seem to be major challenges at a lot of organizations that I see.
Well, Mike, we've got a lot of participation, so I'm going to close the poll now, and let's take a look at those. Take a look at those results.
Wow. So missing or incomplete requirements takes the cake, but in close second comes not enough time to test. And obviously test data and test environment issues, and all of us face budget challenges every once in a while. We'll get into that along with our trends. So in life sciences and healthcare IT, you face all of these burdens, plus the additional burden of government regulations and guidelines related to computer system validation. And that brings up our number one of the top 10 trends for 2015. Next slide, Alex.
There you go. There's our first trend. It's compliance testing and ICD-10. Now, you highlighted just a second ago that regulation is always a major driver for testing. And ICD-10 in particular in the healthcare space is a focus for payers and providers in 2015. What are your thoughts there, Mike?
Yeah, so with over 50% of the providers saying that they hadn't even begun their external testing as of the middle of last year, this is definitely a concern. In many ways, compliance testing is business as usual for healthcare IT, insurance, and pharma companies who have had to be extra diligent with QA controls like documented, expected, and actual test results, e-signature, approvals, and obfuscated test data because of regulations like HIPAA, FDA 21, CFR Part 11, and many more. This trend made our top 10 list in 2015 because of the broad IT impact of ICD-10 testing and the looming deadline to get the work done by October of this year. Many organizations are augmenting their internal testing teams with experienced ICD-10 testers to address this massive effort. I recommend taking the opportunity of the ICD-10 testing initiative to refresh both your manual and automated regression test suites. Let's see how the team is, how the participants are doing on their ICD-10 testing. Let's launch the second poll question. Alex, please.
Okay, Mike, here comes that second poll. We're asking everyone in our audience, where are you with ICD-10 testing? Of course, some of our registrants may not have anything to do with ICD-10 in their organization, but many payers and providers in particular still have this as a challenge. They did last year and are still working on their external testing, as you indicated, even as we speak, Mike. We'll give folks about 30 seconds to answer the poll question as they see it on their screen, and then we'll hear your take, Mike.
Yeah, absolutely, Alex. You bring up a good point. There may be participants who've never heard of ICD-10, and basically what it is diagnosis codes that are much more specific than ones used in the past standard, which was ICD-9. So what's happening is a lot of companies are having to test many systems. In fact, we're engaged with a large hospital system, IDN in the Midwest, where we're having to test dozens of systems across 85 hospitals.
Okay, Mike, I'm going to close the poll. I'm going to close for all of our registrants here, and we'll take a look at our results. So there you go, Mike. Some good news is a lot of folks seem to be on track for the October 2015 deadline.
Okay, great. So hopefully we answered the question of what is ICD-10 for those 18% who don't know. It's the upgrade of the diagnosis codes that impact a lot of hospital and payer and provider related systems, and a lot of systems, a lot of the participants don't need to test it, and some are behind. The good news is 41% are on track, and this certainly is a top trend. And in the first area, we talked about some technology-related trends, and gone are the days that we're only doing testing on personal computers. Let's discuss trend number 2. Okay?
All right, Mike.
Technology-related trend. Yeah.
There you go. Mobile testing is our second trend here. Let me just make sure that we have that on screen. Can you see that? There we go.
There it goes. Yep.
So mobile testing is trend 2. Of course, mobile apps and devices, as you mentioned, are becoming increasingly common in the workplace and in the healthcare workplace. And this stat here in the bottom of our screen really jumps out at me. By 2018, nearly 2/3 of consumer transactions with healthcare organizations will be mobile transactions. What's the impact that you see for testers there, Mike?
True, and this is a topic that's near and dear to my heart. The second trend, like you said, is mobile testing, and healthcare and life sciences companies have truly embraced mobile technology with applications touching every aspect of patient care and administration, which all need to be tested. When testing mobile apps, I recommend that you test with a combination of the most popular devices and mobile operating systems the applications run on. Now, don't forget to consider network performance. For instance, do you know if your mobile EMR or claims app might time out if you're in an area with a slow 2G network or an overloaded Wi-Fi network? For this type of mobile testing, I can tell you from experience that emulators, device emulators, just won't cut it. Be sure to do functional, security, and performance testing with a representative set of devices like iPad, Android, and Windows. And you can usually find out in your application logs which devices and operating systems are being used so you can focus your testing. I recommend that you consider looking into a public or private cloud for mobile application testing. Some of the top mobile testing vendors are HP, Perfecto Mobile, Keynote with Device Anywhere, and Mobile Labs. And talking about clouds, that leads us up to topic number 3. Next slide.
Yeah, our third trend here, Mike, is the cloud and software as a service, and very much related to those two is big data. Mike, what do all of these mean for testers?
Alex, it's incredible how many applications are moving to the cloud. Many companies are embracing new cloud technology for the business, like Salesforce.com and Viva, and many EHRs and EMRs have moved their data to the cloud, allowing for big data analytics projects. The migration and data cleanup efforts to move to the cloud require significant testing. Consider parallel system testing during migration, running with the old system and the new system. There have been several new innovations in cloud-based performance testing, specifically by companies including Suasta and HP with their new Storm Runner load, which allows you to generate load tests from the cloud from different locations. Now, service virtualization is also needed when you're doing cloud testing or testing with a third-party application when you don't have access to their production, or when you don't want to, for example, make real payments. You can virtualize that service or create a test harness. When it comes to big data, you'll likely need more technical testers, white box testers with SQL and scripting skills. One more thing, when testing cloud-based apps, be sure to test role-based security. Often you'll get different results depending on who you log in as, if they have different security levels, which is a nice segue into trend number 4. Next slide.
Okay, Mike, you're right. Trend 4 is security testing. Of course, there were a lot of high-profile security breaches at healthcare entities in 2014, and it's only going to get worse. You see the stat on the slide here. Half of healthcare organizations this year may have experienced 1 to 5 cyber attacks in the past 12 months, and 1 out of 3 of those attacks may be successful, though, so that's pretty scary stuff. What are the implications of all this for testers?
It is very concerning. Most IT organizations have very small security teams led by a Chief Information Security Officer, or CISO. They're typically focused on firewalls, penetration tests, virus prevention, compliance, and audits. This often leaves application-level security testing to development and QA teams. Now, hackers are getting more and more sophisticated in using automated robots looking for software vulnerabilities like cross-site scripting or SQL injection, where a hacker might put a SQL statement into the login to try to get your user data. Automation and static plus dynamic code analysis is often the most efficient way to test for security vulnerabilities. You will likely need to tune your automated security tests to eliminate a high number of false positives. Many companies focus on the top security standards like the OWASP top 10 vulnerabilities, and I've included a link if you'd like further information on that topic. With best practice sharing in mind, let's discuss number 5, trend number 5.
Okay, Mike, and there it is, trend 5. Testing Centers of Excellence, or TCOEs. And again, a telling stat on screen here from the World Quality Report. Just a few years ago, almost no one was running TCOEs, but now 1/4 of all global IT organizations report fully operational Centers of Excellence for testing. So, Mike, is this a trend that's coming to the healthcare industry?
Absolutely, Alex. You're right. Many industries like telecom, banking, retail, and insurance have embraced the concept of testing centers of excellence. With many mergers and acquisitions going on in healthcare, the need for centralization, standardization, and shared resources just makes sense. Often, test automation and performance testing are the first areas to be centralized to make efficient use of the time of those skilled resources and expensive tools. There are many proven best practices, metrics, and key performance indicators that help to demonstrate the value of a good TCOE. However, if done poorly, you can end up with a testing center of mediocrity using industry worst practices, and nobody wants that. I recommend getting help from an experienced professional to help roll out a successful TCOE. Some companies even have Agile COEs these days to standardize Agile practices. So let's sprint to trend number 6.
Okay, I think I know what's coming here. Yes, number 6 is Agile development and testing. And this is kind of similar to the TCOE trend in that 5 years ago, Agile wasn't widely used. And today, of course, almost half of organizations, according to this stat from Forrester, are now using some form of Agile development methodology. Mike, you're a Scrum Master. What are you seeing among our healthcare clients?
Actually, I can give you some experience from just before this meeting. I actually just came out of a sprint retrospective for a life sciences related company. And what we're finding is many healthcare IT organizations actually do minimal development in-house. However, for the healthcare and life sciences companies that do development, more and more are using Agile development methodologies like Scrum. Agile methodologies are typically in sprints of 2 to 4 weeks and require a high level of team collaboration and trust. If your organization needs to manage Agile at a project, program, and portfolio level, you may need to consider the Scaled Agile framework, also known as SAFe, or Enterprise Agile. Testers are often embedded in the sprint team in Agile, and if that's the case, you want to make sure that the testing activity is reflected in the backlog for a true picture of team velocity. For testers that are used to waterfall software development life cycles, it's important to get some Agile training. Automation is critical for most Agile teams, and some teams even do test-driven development. Agile works best with co-located teams, and that brings us to trend number 7.
Okay, Mike, well, we'll take a look at that. And trend 7 is a return to onshore quality assurance and testing. Now, we've certainly seen this as a trend reflected in our own business. Mike, why are more companies looking for onshore testing partners and testers?
Alex, it does seem like everyone's looking for onshore testers these days. And Alex, I'm actually seeing still the Agile on there. Just want to make sure I'm on the right trend. Okay.
Yeah, we have the slide, so just keep going with your talk track, and we'll take a look.
Yeah. Okay, so it does seem like everyone is looking for onshore testers these days. We've recently had to expand our 2 rural testing facilities because of demand for team growth. During the deepest part of the recession, it was very popular to move a high percentage of software testing offshore. However, in healthcare IT, there's a greater need for privacy, security, and quality. These concerns, along with salary inflation overseas, immigration law changes, and communication issues, are causing many companies to bring testing back onshore. When working with an offshore or onshore vendor, it's important to set expectations up front. Many system integrators offer testing of the system that they're implementing. I recommend having an independent third party doing the testing so you don't have a situation where the fox is watching the hen house. The QA practice I'm describing is called independent verification, or IVMV. Recently, we visited a hospital where they were upgrading their version of Epic, and they noted that some of the issues took a while to come to light, and agreed that in this case IVMV probably made sense. So we're looking into that. Testers often require special skills, which leads us to trend number 8.
And there's trend number 8 on screen, Mike. Test specialization. Again, like the onshore trend, this is one that we're seeing at healthcare IT leaders directly in our business. Mike, what kinds of specialized skills are we talking about here?
As QA and testing evolves as a career path, there are definitely distinct specialties. It's not uncommon that we get a call for testers with very specific skills, such as Epic certification, ERP like SAP, or CRM like Salesforce testing experience, and even CSV testing experience with knowledge of GMP, and as I mentioned before, compliance or ICD-10 testers, and mobile testers are in huge demand this year. Often it's better to find a testing partner with deep healthcare experience instead of looking for a partner with the lowest rates. Many companies have learned the long run that not all testers are the same, and manual testers are not always the best at automating test cases. With automating and automation test tools in mind, let's move to trend number 9.
Our 9th trend is testing tool innovation, as you alluded to there, Mike. And as the stat on screen shows, automated testing software is just huge. It's a $2.4 billion global industry and growing. And Mike, it seems like every year there are new and better tools aimed at increasing the efficiency and quality of testing.
That's true, Alex. In the old days, there were only a few choices when it came to test automation and test management tools. These days, there are several more options from commercial companies like HP, the traditional Quality Center ALM and Unified Functional Testing, or QTP. And now there are a lot more choices, from open source like Jira, Selenium, and Cucumber, and then solutions in the middle, like SmartBear or QA Symphony. There are several tools focused specifically on Agile testing, mobile testing, and even performance testing in the cloud. Many open source automated test tools like Selenium require testers with development or at least advanced scripting skills. And these testers are in high demand and often come at a cost premium. With all of the regulations in healthcare, a commercial tool set is often a safe choice because they support things like e-signature, screen prints, and test step documentation. Many testing efforts require user acceptance testing, and it's often easiest to manage UAT with untrained testers in an Excel-like framework. And these frameworks can be used in data-driven automation later on. Many of the commercial tools, like those from HP, IBM, Microsoft, now have community editions and SaaS options, which are more competitively priced than just a few years back. So if you hadn't looked at tools for 6 months or a year or two, definitely take another look, because there have been a lot of innovations and even pricing changes in this market. These tools do require an investment, which brings us to our final trend in our top 10. Next slide.
I feel like we should have a drum roll here, Mike.
All right.
10th and final trend is indeed QAT spending increases. And you talked about some of those investments, IT organizations spending more on test automation, on testing environments, and hiring more specialized talent. On average, as this statistic on our screen shows, QAT is now a quarter of the IT budget in many organizations globally. Mike, I guess if you're a testing professional, that's good news.
Yeah, it is good news, Alex. The final trend, like we said, is an increase in investment in QA and testing in 2015. And this is driven by business, transformational technology, and regulations. The very public quality issues surrounding the initial healthcare.gov launch has raised the awareness very publicly for the need for investment in healthcare IT quality. With increased spending comes greater scrutiny. My recommendation is focus on the highest value testing activities and be sure to demonstrate and communicate the value often. When adding testing resources, consider whether you need them short-term or long-term. Investment of more than a quarter of IT budgets in QA may seem high. However, to fully measure the total cost of quality, you have to look at the big picture. And let's look at the big picture, Alex. Next slide. Above the surface, QA investments to ensure good quality are just the tip of the iceberg. Below the surface, if quality is ignored, the costs of poor quality, such as underbilling, lower reimbursement levels, suboptimal patient care, and even litigation and fines, can be disastrous. In the end, the most important thing to remember is to be patient-focused and to be business-focused in your QA and testing activities and investments. Best of luck in 2015. Now, we did leave an adequate time for questions and answers. Alex, can you go ahead and queue up the first question?
Yeah, absolutely, Mike. We've got a lot of great questions from our panel. So let's start. I'm going to throw out the first one, actually. I'd love for you to tell us more about testing centers of excellence. You mentioned that the ideal TCOE is driven by specific metrics and KPIs. What are some key metrics that you think are important for a successful TCOE?
When you're talking about a testing center of excellence, a lot of that is driven by the need for visibility, having a plan and working the plan. So often plan versus actual is what people want to know about. In Agile terminology, a lot of times it's a burn down chart. The other thing is pre-production versus post-production defects, or this is also known as escaping defects. Are you finding or detecting the defects up front, or are your customers or patients finding them for you? So those are a couple. And then one other thing is, make sure you're considering some business metrics, and whether it's conversion rate on the web, or even some technical metrics like uptime. Every operations executive wants 5 nines stability in their data center, for example. Next question, Alex?
Yeah, this is a related question. I feel like one of our respondents asked, what type of metrics do you recommend to demonstrate the value of QA in an organization? And I sense that your response is much the same, really tying QA and testing back to business value. Absolutely.
The other advice I would give is metrics mean almost nothing in a vacuum. When I've been successful demonstrating the value, a lot of times it's in a release-over-release comparison. Metrics also give you a benchmark for future estimation, for example. But that would be my recommendation there. Is keep trends of your metrics so you can see improvement over time, and that's where the value comes in.
Okay, Mike, our next question comes from a respondent who wants to know, and go back to our initial poll question, where most people responded that lack of requirements was their biggest challenge from a QAT perspective. And our questioner wants to know, do you think that's because the adoption of Agile methodologies? And if so, can organizations more clearly define requirements in an Agile environment?
Yes. So when you're dealing with that, the problem with bad requirements is an age-old requirement, is an age-old issue. I don't think anybody has ever said, oh, my requirements are perfect or too good. But with the advent of Agile, there is a huge dependence on hallway meetings, and I will tell you, 5 or 6 words on a sticky note is really sometimes very hard to test. So a lot of companies who are more enterprise companies are going to more of an enterprise Agile or scaled Agile framework, which do have a little bit more documentation than the original kind of founders of Agile had with note cards and sticky notes on a whiteboard. At HP we used Agile Manager. A lot of people use things like Rally or Version 1 or Jira to capture user stories rather than requirements.
Okay, Mike, our next question harkens back to mobile testing. One of our questioners is curious if you have any ideas on how to determine what the most popular mobile devices are. The questioner observes that there don't seem to be any surveys that break out popularity of specific phones by user segment and averages across an entire population, may not necessarily apply to doctors and other healthcare professionals who may skew more affluent and tech-savvy. So again, I think our questioner wants to know, if you are in an environment where you need to do mobile testing, what's the best way to kind of get your handle around what the most prevalent devices are that you should be testing on?
So there are several ways. One is you can survey your user base. Okay, that's one way. Another way is you can look at the logs, if you have that available, to see what's actually hitting your database. There are certainly reports that you can either that you can purchase that give that information, and there are some free reports online, but they are more generic, as mentioned. But obviously, just to summarize, is asking your user base. There is and then looking at the logs are probably the two most reliable ways.
Yeah, and I think especially in a bring your own device environment, it really is critical, it seems, to be ready to test all types of devices, because there just are so many, and if you're in a BYOD organization, you have to be ready for any type of mobile device and app among the major mobile developers.
True.
Mike, a last question for you here. When do you recommend automated testing versus manual testing? Can you expand on that?
So when I talk about automation, a lot of times it's automating certain tasks that make your life easier, whether it's the setup of the environment, whether it's a build verification test, and that would be a good example. Automating a script that verifies that the major business functions work in your application. Things that are stable are typically things that are good to automate. Things that are have repeatable actions, and that will allow your testers to focus on the areas that require more judgment. Now, a lot of people think that almost everything should be automated, but that in some cases is very difficult. So I would focus on, like I said, the things that are stable and repeatable. Those are two guidelines there, and obviously there's the whole automation that goes along with unit testing. So those are some suggestions. Actually, one more that I just thought of, Alex, is a lot of times when an application doesn't have a GUI, it is good to do your service testing in an automated manner through an API, for example, to make sure that your services are working. Thank you.
Great. That's great advice, Mike. I've also had a note from one of our audience members that for anyone in the Atlanta area, you're on the board of the Atlanta Quality Assurance Association, and that networking group has a meeting on February 10th, so if you're in Atlanta and you want to meet with Mike, you can do so at that event. I want to thank everyone. In closing, I also want to tell you about a special offer for all of our webinar attendees today. If you have any testing concerns or challenges like those you've heard on our webinar and you think you might benefit from a consultative assessment, Mike is available to help. His initial discovery assessment is free, and so if that's of interest to you, then let's certainly be in touch after the webinar today. Again, I want to thank everyone. I want to thank you, Mike, and all of our audience for their great questions, and have a great afternoon.
Thank you.